Changing a PICC line dressing and the needle-free devices, NFDs. These procedures have been developed from current evidence in order to preserve vascular access and prevent infections and occlusions. When you are performing line care, an aseptic technique should be followed precisely at all times. Please note that underneath the PICC dressing there is a securing device called a stat lock, which holds the PICC in place. This only needs to be changed the day after insertion and thereafter monthly unless wet or soiled. The IV advanced dressing on top of the stat lock should be changed once a week. The needle-free devices should also be changed weekly. In order to change your patient's PICC dressing and needle-free devices, NFDs, you will need the following items. 1 apron, a trolley and large Clinell universal wipes, a dressing pack, 2 times 10 ml sodium chloride posi flushes, 2 pairs sterile gloves, 5 small Clinell wipes, 1 swab cap, 1 NFD, 1 IV advanced dressing, 1 PICC stat lock dressing, alcohol gel, Chloroprep 3 ml wand. Note, for a double lumen PICC, change the quantity on these items to 4 times 10 ml sodium chloride posi flushes, 10 Clinell wipes, 2 swab caps, 2 NFDs. Once your equipment is gathered, gel your hands and place some large Clinell wipes on the trolley. Wash your hands fully using infection control procedures for hand decontamination. Use the large Clinell wipes to firmly clean over each surface using an S-shaped movement from top to bottom, only once. Allow trolley to dry. Put on apron. In order to keep the dressing pack sterile, open the packaging without touching the insides and drop it onto the trolley. As you are about to touch a sterile item, alcohol gel your hands. Create a sterile field by opening the dressing pack using only the corners. The swab cap is not sterile at this point. Clean it thoroughly with a small Clinell wipe before dropping it onto the sterile field. You can now open the rest of the equipment, placing them onto the sterile field. Now expose the PICC line. Assess the line site for any signs of infection. Look at the Radiology Care Plan Welsh Clinical Portal for the insertion measurements and then observe the PICC measurements on the line. Count from 0 inwards towards the body. Each white dot is 1 centimetre. The insertion measurement should also be stated on the top of the surveillance form. If the line has displaced by more than 2 centimetres from the insertion measurement, do not use the line and promptly ask your nutrition nurse or ward doctor for advice. A full hand wash is now required. Dry your hands thoroughly and put on your sterile gloves. Open up your small wipes and sterile drape to make them easily accessible. Hold a wipe in each hand. Use one wipe to hold up the line, use the other to clean down the line, including the clamp, and remove swab cap. Only touch the line with the wipes. Discard wipe and swab cap. Use a clean Clinell wipe to clean the end of the needle-free device. Scrub the hub for 15 seconds and allow to dry. Keeping the line elevated, place the sterile drape over the arm. The line can now be dropped onto the sterile drape. Discard the Clinell wipe. Pick up the first PICC. Expel airlock in syringe and then attach to the needle-free device. Unclamp the line. Using a PICC, flush the line using a push-pause technique. As the last 1 ml is being flushed, close the line clamp to provide positive pressure. Discard syringe. Remove the needle-free device and using a clean wipe, scrub the area underneath well and then allow to dry. Attach the second PICC to a new needle-free device and prime. Then attach to the PICC and flush through. Place swab cap onto the end of the line and remove plastic sheath. If using a double lumen PICC, repeat this process for the second lumen. Now peel off the IV advanced dressing and discard. Remove your sterile gloves. Put on your clean pair of sterile gloves. Carefully remove the stat lock. If new to this skill, please ask a second nurse wearing sterile gloves to help you keep the line still. There is risk of displacement at this point. Activate ChloraPrep wand by squeezing wings together. Clean the PICC line site in a hashtag motion. Allow to dry. Align the PICC line into the stat lock slots and close doors. Position stat lock comfortably for the patient and secure to skin. Place an IV advanced dressing over the top, ensuring site and measurements are visible. Remove gloves, discard waste, wash hands. Complete PICC line surveillance form. Some PICC lines have a device called a Securacath instead of a stat lock. The metal clips hold the line in place under the skin. This stays in for the entire lifespan of the PICC line. To redress a PICC line with a Securacath, a simple IV transparent dressing is required to be changed once weekly. Monitor the skin around the site for any pressure damage. If the PICC line needs to be removed, please contact your nutrition nurse specialist for advice.